What if I told you that one of the most powerful things you can do for your testosterone, your circulation, your energy, and your intimate life tonight costs you absolutely nothing and takes exactly zero effort? No supplements, no gym, no special diet, just you, your bed, and one simple decision before you close your eyes. I know that sounds almost too easy, but stay with me because what I'm about to share with you is backed by real biology, real clinical experience, and it's something most men over 50 have never been told by their doctor. I'm Dr. Olivia Brooks, a urologist, and in my years of clinical practice working specifically with men over 50, I've had thousands of conversations about testosterone, vascular health, sleep quality, and performance. And one habit keeps coming up quietly, consistently, as something that genuinely moves the needle. Something so simple it almost seems like it couldn't possibly matter. Sleeping without clothes, that's it. No catch, no product to buy. Just your body, free to do what it was designed to do while you sleep. And today, I'm going to walk you through exactly why this matters, what it does for your hormones, your blood flow, your stress levels, and your relationship, and how you can start tonight in a way that feels completely natural and comfortable. But before we get into the science, I want to hear from you. Drop a comment right now. Where in the world are you watching from? I genuinely love seeing the community that's building here. Men from every corner of the world taking their health seriously. And if men's health matters to you, please give this video a thumbs up. It tells the algorithm to put this in front of men who need it. And if you haven't subscribed yet, hit that button now so you never miss a video. We post straight, honest, science-based urology content every week, and I don't want you to miss what's coming. All right, let's get into it. First, let me tell you about a patient I'll call Mark. Mark came into my office a few years ago. He was 57 years old, sharp guy, successful, but he was exhausted in a way that sleep wasn't fixing. He'd wake up feeling like he hadn't slept at all. His energy during the day was flat. His mood was irritable. His wife had started making comments about how distant he seemed, and his morning performance, something I ask all my male patients about because it tells me a great deal about vascular and hormonal health, had become inconsistent. We ran his blood work. His testosterone was low normal, not crisis level low, but not where a man in his late 50s who exercises and eats reasonably well should be. His cortisol was elevated. His sleep quality, based on his self-report, was poor. I asked him about his sleep routine. He told me he wore thick cotton pajama pants and a t-shirt every night because, he said, that's just what you do. We made several changes together, but one of the simplest ones, one he laughed at when I suggested it, was removing the heavy sleepwear. 3 months later, he came back for a follow-up. His energy was better. His mood had lifted. His wife had noticed the difference, and his morning performance had returned with consistency that hadn't been there in years. Now, I'm not telling you sleeping naked fixed everything for Mark. We made other changes too. But this is what I want you to understand. Sleep is not passive. Sleep is medicine. And what you wear, nor don't wear, during that medicine time matters more than most men realize. Let me explain exactly why. It's the biology of sleep that nobody talks about. Most men think of sleep as simply off time. Your body shuts down, you rest, you wake up. But that's not what's actually happening. While you sleep, your body is running a full restoration program. Your brain is processing and consolidating memories. Your immune system is deploying repair cells. Your blood vessels are recovering from the demands of the day. And critically, your endocrine system, the hormonal command center of your body, is doing some of its most important work. Testosterone, the hormone that drives your energy, your motivation, your muscle strength, your mood, and yes, your intimate performance, is primarily produced and released during sleep, specifically during deep sleep. The slow wave stages where your brain waves slow down and your body enters its most restorative mode. Growth hormone follows the same pattern, released mostly during deep sleep, responsible for tissue repair, fat metabolism, and maintaining the lean body composition that becomes harder to hold on to after 50. Here's what disrupts all of this: poor sleep quality, specifically failing to reach and sustain those deep sleep stages. And one of the most common and most overlooked causes of disrupted deep sleep in men: overheating. Your body has a beautifully designed system for initiating sleep. As evening approaches, your core body temperature begins to drop. This isn't accidental. This drop in temperature is one of the primary signals your brain uses to trigger the release of melatonin, the hormone that makes you feel sleepy and carries you into deep, restorative rest. The cooler your core temperature gets, the deeper and more efficiently you sleep. Now here's where the pajamas become a problem. When you sleep in heavy pajamas, especially synthetic fabrics that trap heat, you create a warm microclimate around your body. Your core temperature can't drop the way it needs to. Your body is working against itself. Melatonin release is blunted, deep sleep is disrupted, and the cascade of hormonal restoration that should be happening during those quiet hours, interrupted. For men over 50, this isn't a minor inconvenience. This is a direct hit to testosterone production, energy levels, cognitive clarity, and emotional stability every single night. Sleeping without clothes removes that barrier. Your body can cool the way it was designed to. The temperature drop signals proper melatonin release. You fall into deeper sleep faster. You stay there longer, and your hormonal system gets to do its job without interference. This is not a controversial idea. This is basic thermoregulation science applied to sleep physiology. And for men over 50 who are already dealing with natural hormonal changes, optimizing every single factor that supports hormone production is not optional. It's essential. On the testicular temperature factor. Now I want to get specific here, because as a urologist, this is something I discuss directly with my patients, and it's critical for men to understand. Your testes have a specific job. They produce testosterone and maintain reproductive health, and they are anatomically positioned outside the body for one very precise reason. They need to stay cooler than your core body temperature, usually 2 to 4 degrees cooler. When testicular temperature rises, even slightly, even temporarily, testosterone production drops. This is well documented in urological research. It's why sitting for long periods, tight underwear, and yes, sleeping with heavy fabric trapping heat in that region all contribute to suboptimal hormonal function. When you sleep naked, you allow natural cooling of that entire region, night after night. That consistent, low-temperature environment is exactly what your body needs for healthy, sustained testosterone production. Think about what this means over weeks, over months. Every night you create the right environment, you're giving your body a better shot at producing the hormones that determine how you feel, how you perform, how you recover, and how you show up in every area of your life. This is why I tell men over 50 that the bedroom environment is as important as the gym. What happens while you sleep is actively shaping who you are when you wake up. Why? Blood flow, the quiet conversation your body has every night. Here's something I tell every man who sits across from me in my clinic. Erections are a vascular event. They are not primarily psychological. They are circulatory, blood flow in, blood flow maintained. And the health of that process is one of the most sensitive early warning indicators of overall cardiovascular health. Before heart disease shows up on a stress test or an imaging scan, before blood pressure becomes a clinical problem, before cholesterol numbers trigger medication, the quality of a man's erections often begins to quietly tell the story. This is why, as a urologist, I take performance concerns seriously, not just as a quality of life issue, but as a diagnostic window into vascular health. And what is one of the most consistent, nightly contributors to restricted blood flow in men? Compression, tight waistbands, snug underwear elastic, pajama legs that wrap around the thighs, All of this creates low-grade compression around the very blood vessels and nerves that supply the pelvic and groin region. Add heat, which causes blood vessels to work differently than in a cool environment, and you have a recipe for reduced blood flow, reduced tissue oxygenation, and reduced nerve sensitivity, night after night. When you sleep without clothing, you remove that compression. Your blood vessels can expand fully. Your skin, which is one of your largest circulatory organs, breathes freely. The nerves in your pelvic region are no longer compressed against waistbands for 7 or 8 hours. For men over 50, whose vascular system is already under more demand than it was at 30, this matters. The difference between optimal nighttime circulation and restricted nighttime circulation over months and years is significant. Clinically, I've seen men report stronger and more consistent morning responses, a sign we actually look for as urologists because it indicates healthy nighttime blood flow and hormonal function, after making this single change in combination with other healthy habits. I want to be honest with you. I'm not promising this one change will reverse serious vascular disease. If you have significant cardiovascular issues, you need to work with your physician on a comprehensive approach. But for most men over 50 who are otherwise reasonably healthy, removing unnecessary nightly compression and heat is a simple, zero-cost intervention that supports better circulation while you sleep. And better circulation while you sleep means better recovery, better tissue health, and yes, better performance when you're awake. The cortisol problem and why your nervous system needs freedom. Let me shift for a moment from hormones and blood flow to something equally important: stress physiology. Cortisol is your primary stress hormone. It has a natural daily rhythm. It should peak in the morning, helping you wake up, feel alert, and get moving, and decline steadily through the day, reaching its lowest point late at night when your body shifts into recovery mode. For many men over 50, this rhythm is disrupted. Cortisol stays elevated too long into the evening. This causes difficulty falling asleep, lighter sleep, more waking during the night, and early morning awakening. And elevated cortisol has a direct suppressive effect on testosterone. They are inversely related. When one goes up, the other tends to come down. Poor sleep quality raises cortisol. Elevated cortisol worsens sleep quality. It's a cycle, and once you're in it, it's hard to break. One of the factors that keeps cortisol elevated at night is thermal discomfort. Your body's threat detection system, the nervous system, is sensitive to temperature. When your body is too warm during sleep, your nervous system perceives this as a mild stressor. Cortisol stays higher than it should. Sleep suffers, testosterone suffers. Sleeping without clothing is a simple way to reduce that thermal stress signal. When your body can cool naturally, your nervous system gets the message that conditions are safe and optimal for deep recovery. Cortisol drops appropriately, melatonin rises, deep sleep happens, and your hormonal system gets to do its restoration work undisturbed. There's also an element here that I want to address for men who share a bed with a partner. Skin-to-skin contact between partners triggers the release of oxytocin. This is sometimes called the connection hormone, and its effects are profound. Oxytocin lowers cortisol. It reduces blood pressure. It calms the nervous system. It creates feelings of safety, closeness, and emotional bonding. For men over 50 who may be navigating the emotional challenges of this life stage, stress from career transitions, health concerns, relationship changes, the natural psychological adjustments of midlife, this kind of genuine physical closeness is not a small thing. Researchers in the field of psychoneuroimmunology, the study of how our emotional and psychological states affect our immune and hormonal systems, have consistently found that emotional bonding and physical closeness have measurable positive effects on hormonal health. Sleeping naked next to your partner isn't just a lifestyle choice. It's a biological and emotional health practice. It reconnects you to your partner in a quiet, consistent, non-performative way that builds intimacy over time. And that intimacy, That sense of being truly close to another person has downstream effects on your stress levels, your hormone profile, and your overall well-being. For men who sleep alone, this habit still carries real value. Sleeping without clothing is, at its core, an act of self-acceptance, of physical comfort in your own body. And that relationship with your own body, how comfortable you are in it, how much you accept and respect it, has direct psychological effects on your confidence, your posture, your presence, and the way you move through the world. But Dr. Brooks, I've never done this. Where do I even start? I hear this all the time, and I want to give you a real, practical, thoughtful answer. Because comfort matters, and habits only stick when they feel manageable. Start gradually. If going completely without clothing feels too unfamiliar, that's fine. Start with just removing the pajama bottoms. Wear a light, breathable top if that helps. The most important change is removing tight waistbands and heavy fabric from the lower half of your body, the region where temperature and compression have the most direct hormonal and circulatory impact. Give yourself a week. Then try removing the top. Let your body and your comfort level adjust at a pace that works for you. Your bedroom environment matters enormously. The ideal sleeping temperature for most people is between 65 and 68 degrees Fahrenheit, roughly 18 to 20 degrees Celsius. If your bedroom is warmer than this, sleeping without clothes will feel uncomfortable even if you do it right. Consider adjusting your thermostat using a fan or switching to breathable natural fiber bedding. Cotton, linen, and bamboo-derived fabrics are far better for thermoregulation than polyester or microfiber. Small environmental changes that support the habit will make it sustainable. A warm shower before bed is one of my favorite recommendations. This sounds counterintuitive. If we want to cool down, why take a warm shower? Here's the physiology. When you step into a warm shower, your blood vessels dilate and move heat toward the surface of your skin. When you step out and the water evaporates, that heat dissipates rapidly. The result is a quick drop in core body temperature, exactly the signal your brain needs to initiate melatonin release. A warm shower 60 to 90 minutes before bed, followed by sleeping without clothing in a cool room, creates an almost ideal hormonal environment for deep, restorative sleep. Try it for a week and tell me in the comments whether you notice a difference. Build this into your existing routine. Habits stick when they're attached to something you already do consistently. Most men have a before-bed routine, brushing teeth, maybe washing the face, setting an alarm. Add removing your clothes as the final step in that routine. Simple, automatic, consistent. Within 2 to 3 weeks, it will feel completely natural. Manage your expectations in the first few nights. The first time or two may feel slightly strange if this isn't something you've done before. That's completely normal. Your body and your brain are adjusting to something new. Persist through the novelty phase, usually 3 to 5 days, and most men report that they begin sleeping more comfortably than they have in years. If you share a bed with a partner, have a simple, open conversation about it. Many couples who try this together find it unexpectedly positive for their emotional connection and intimacy. But communication matters. Make it a mutual decision. And if you have specific medical conditions, particularly skin conditions that require protection, advanced circulatory disorders, or any condition your physician has given you specific sleep-related guidance about, please discuss this change with your doctor first. For the vast majority of healthy men over 50, this is safe, beneficial, and costs absolutely nothing. What to expect? And when I want to give you a realistic timeline because I believe in setting honest expectations. In the first week, most men notice that they fall asleep a little more easily and wake up slightly less often during the night. Some notice they feel warmer initially. This is usually because they're more aware of their body temperature, not because they're actually hotter. The body adjusts quickly. By the second to third week, many men report waking up feeling more rested, not dramatically different, but genuinely better. Clearer head in the mornings, a little more energy early in the day. Some men notice that their morning response has become more consistent. Again, this is an indicator of healthy nighttime hormonal and vascular function, and it's a good sign. Over several months, when this habit is combined with other healthy practices like consistent sleep timing, appropriate physical activity, real food, and stress management, the cumulative effects become more noticeable. Better mood stability, more sustained daytime energy, improved intimate performance. These aren't miracles. They're the predictable outcomes of giving your body the conditions it needs to function at its best night after night. I want to be very direct with you here because I don't believe in overpromising. Sleeping naked is not a cure for hypogonadism. It won't reverse serious vascular disease. It will not single-handedly restore testosterone levels to what they were at 30. If you are dealing with clinically low testosterone or significant vascular health issues, you need medical evaluation and possibly medical treatment. Please do not substitute lifestyle changes for appropriate medical care. What sleeping without clothing will do is remove an unnecessary barrier to your body's natural restoration processes. It will optimize one small but significant piece of the overall sleep environment. And when sleep improves, truly improves structurally, hormonally, the downstream effects on every other aspect of your health are real and meaningful. The bigger picture. Why this matters at 50. I want to take a moment to talk directly to you, not as a patient, as a man navigating a specific chapter of life. 50 plus is a strange age in our culture. Society sends men very mixed messages about it. On one hand, there's the "you're in your prime" narrative. On the other hand, there are constant reminders of decline. The jokes about energy disappearing, the ads for supplements, the quiet cultural assumption that vitality is for younger men. I reject that narrative, and I want you to reject it too. The men I've seen in my clinic who are thriving at 55, 60, 65, and I've seen many of them, are not doing it by accident. They are intentional. They pay attention to their bodies. They take their sleep seriously. They make consistent, sustainable choices that support their health. They are not waiting for a dramatic intervention. They are stacking small decisions every day, every night that compound into real, lived vitality. Sleeping naked is one of those decisions, small on the surface, meaningful in practice. It's a way of saying, without anyone watching, without any audience, I take my body seriously. I am not resigned to feeling worse as I age. I am going to give my body every reasonable opportunity to heal, restore, and function well. I still matter. My health still matters. My vitality still matters. That mindset, that quiet, private commitment to your own health, is more powerful than any supplement. It's more sustainable than any crash program. And it starts with something as simple as what you decide to wear or not wear when you close your eyes tonight. I know we covered a lot today, so let me bring it together clearly. Sleeping without clothing helps your body cool to its ideal temperature for deep, restorative sleep. That cooling triggers proper melatonin release, supports the deep sleep stages where testosterone and growth hormone are produced, and gives your hormonal system the environment it needs to restore and reset every night. It reduces heat and compression around the testicular region, where temperature directly affects testosterone production. It removes unnecessary compression from blood vessels and nerves in the pelvic and groin area, supporting better circulation and vascular health. It allows your skin to breathe, your nervous system to downregulate, and your cortisol levels to drop the way they're supposed to during sleep. And when shared with a partner, it supports the physical closeness that triggers oxytocin, the bonding hormone that lowers stress and deepens connection. None of this requires anything from you except a decision tonight. Start where you're comfortable, adjust your environment, be patient with the adjustment period, and pay attention to how you feel after 2 or 3 weeks. I think you'll be surprised. Here's what I want you to do right now. If this video gave you value, if it changed how you think about sleep even slightly, please give it a thumbs up right now. It takes 1 second and it helps this information reach more men who need it. Subscribe to this channel if you haven't yet. We publish honest, clear, science-based urology and men's health content regularly, and I want you to have access to all of it. Most importantly, drop a comment below. Tell me where you're watching from. I genuinely read the comments and love seeing this community. And tell me, are you going to try this tonight? Have you already been sleeping this way and noticed a difference? Your experience matters, and other men in this community will benefit from hearing it. I'm Dr. Olivia Brooks. Thank you for investing time in your health today. That decision alone, to show up and learn and take your well-being seriously, says a great deal about the kind of man you are. Keep making those small, consistent choices. They add up to something remarkable. Take good care tonight. I'll see you in the next video. Disclaimer: this video is for educational purposes only and does not constitute medical advice. Always consult a qualified healthcare professional before making changes to your health routine, particularly if you have underlying medical conditions.